to turning back the clock, it used to seem like going under the knife was the only option. But things have certainly changed just in the past decade. And now today, there is a revolutionary way to take years off your face in just a couple of hours. Here to show us the ropes or the tools of the trade, please welcome from the Institute of Anti-Aging, Dr. Richard Leconey, his wife, and clinic director Dana Leconey, and their patient, Carol Briley. So, Carol, you got your little numbing cream on right there because we're going to show some things in just a couple of minutes here. But first, a lot of us, Dr. Leconey, when it comes to the aging, we can identify ourselves in so many areas where those wrinkles occur with the 1s, 2s, or 3s. Do y'all know what I'm talking about, the 1s, 2s, or 3s? Okay, when you frown, do you have that single line between your eyes, the double lines, or the 3 lines?
Yes, and it's largely a matter of degree, you know, how many of those you have. You know, they're kind of worry lines, concern lines, you know, that's lines of facial expression. You know, so
mad lines.
If you express yourself, if you're real animated, you get a few more of them. That's what you get in return for that.
I'm just happy now that after a slight visit, my son goes, "Mommy, you don't get mad anymore." You're right, honey. I don't listen to the voice though when I'm talking to you. Listen to the voice. All right. So aging, it happens to all of us.
Right. You know, and the face ages in many ways. Loss of volume is a primary way. You know, so a nice full face, you know, like kind of the change I've said before is like the grape to a raisin. So a grape is smooth and lustrous looking, and then after it loses a little bit of the volume, the surface becomes a little wrinkled and it contracts. And that's really one of the things that happens with the face. It just kind of loses little volume, so you see the wrinkled lines contract. And then there's like lines of facial expression like these, right between your eyes. You know,
smile lines.
Smile lines.
Yeah.
Those are the 2 primary things.
And of course, with surgery, you know, you can pull, but the conventional wisdom is that if you can put the plumpness back in, then that is less downtime, but it also gives that more youthful appearance. All right, Carol. So you were seeing things in the mirror that you didn't like, and you just wanted, you didn't want to go crazy. You just wanted to tweak stuff a little bit.
I wasn't pleased with what I was seeing, and the mirror doesn't lie.
And so, well, if you do like I do, I put like some Vaseline on it, and it's good. But okay, so it was those key areas on Carol's face, Dana, where you were seeing kind of, there you go. There's the frown lines there. There's, you can see around the lip.
You know, this is a classic. So she's got a little bit of both of what we just said a minute ago. She's got a little loss of volume, and she's got a little bit of lines of facial expression. These 11s, you know, right there between the eye.
And then, of course, even that kind of downward, you know, on her face.
And the lip curls downward, so it needs a little plumping and a little support in the corner of the mouth. And a little bit, you know, fill right here, plus the Botox.
So there's different ways that we can do that. Filler and things that stop us from frowning. So let's go through her face and figure out, like, what we've done so far.
So we actually did like the Botox in her forehead to stop the 11s.
Yeah, because try to frown for me. See, just a little soft expression. And Dana, you can control it. You can be very conservative. There are some people who will say, I don't want it to move at all.
That's correct. And today we're going to do her frown, her crow's feet. So she's really, it's worn off, so it's time to do it again. She had that done like 3 months ago, so we're going to do a touch-up today.
Yeah, and that's going to be Botox?
That's going to be with Botox.
Okay.
And relax those muscles.
Yeah. Dr. Leconey, again, I want you to talk about Botox because I still get people who ask a question about it and have some concerns about it. But
Botox, it's been around now for so many years. It's probably one of the most widely used drugs in history. Its applications are spreading to almost every field of medicine. Botox is just really, I think, one of the safest things that you can do.
Yeah.
And as long as it's deployed or placed properly, it's going to look great.
And that has a lot to do with the person who is doing the injecting. Dana, you actually train people to do this, and you have done many, many, many of these. So it not just because somebody has a license to do so doesn't mean that they are great at it. So this is one of the things that you do to make sure that people can have some control about what they want it to look like. Also, I noticed on the picture of her before picture, it looked like she had that smoker's lines around her mouth. Were you ever a smoker, Carol? Okay, you were? Because sometimes you see them on people who never even were a smoker, but those are smoothed out as well on around her lips. And so,
combination, again, a little Botox and a little bit of fill right in those lines.
Yeah,
you know?
yeah. And then right in the smile
and
lines.
The corners, see how the corners are nicely supported now, so that the corner of the mouth stays slightly turned upward instead of down.
Yeah. So the whole idea is not necessarily to create a whole new face, but just to smooth things out and make it like it was. Did people notice anything different when you had it done, Carol? What do they think?
Well, I used to wear glasses too, and they thought, "What's different with you?" And I said, "Well, I don't wear glasses anymore."
Oh, okay. I don't wear glasses anymore. I'm not squinting anymore. There's also a look at the forehead there. That so all those expressions that you were making before with Botox, you can stop those expressions from happening and stop it from making those lines even worse. And then the filler, of course, giving you that volume to make you appear even younger. And it can be done in just a matter of minutes in the office, and you go back to work and nobody has to know. All right, well, this month there is a special for Great Day viewers, 30% off Botox. Plus, get $75 off Juvederm fillers and 25% off CO2 laser treatment when you mention Great Day. And complement any skin analysis with any treatment, a complimentary skin analysis as well. For more information on any of the full range of beauty and anti-aging services available at the Institute of Anti-Aging, you can call them at 713-807-1000, 713-807-1000, or go to their website, antiageinstitute.com. Thank you.